We can send the recording.
Okay.
Okie doke.
We are now recording. Don't say anything.
Okay. Wait, not the visuals, right? All right, makeup. Okay, so Michelle has heard and seen all of our little quirks here, but what you're about ready to see is what has been nicknamed a drink from a fire hose of a presentation. So a lot of information comes at you. When Fred does the presentation, he believes that breathing is overrated, so we made him put slides in there for asking questions. But what I want to tell you that really quickly, the background is Fred, 21 years ago, I think he is. He says he's older than dirt. What was hired to build a system for Maricopa County Public Health Department. And he was contracted in to build the health director a operational planning and execution system. So what he was doing and what he was working with was a lot of Excel spreadsheets, trying to find the overlaps, the gaps, commonalities. And so he wanted to have it all into one system to be able to make a comprehensive operational plan and using that PDCA cycle. And this is where the dashboard was born. And in 2011, FAB came along, and lo and behold, the department had a fully demonstrated performance management system. Now, since then, through collaborative efforts of many health departments, we have updated the system over and over and twice over. What we feel is, because we're only in public health, whatever type of customization that might be valuable or add value to any department, we usually add in. And we do that at no charge, because if everybody can glean from it, we're going to have it in the system. That's where the accreditation plan came in. But we're able to utilize the system to reach all levels of your staff, including external partners in your organizational success on your plans. So we define performance management in the dashboard in 3 simple steps. Of course, the first one is the most complicated, but that is creating an operational plan. Creating a plan, that means a specific group of people that are doing a specific set of activities in a specific time frame. And then once they start to execute that plan, you want to monitor it. So where we're monitoring the plan, we're not only monitoring it on the macro level, which would be department-wide, or it could be group-wide, but we want to be able to monitor it before anything goes awry. So that's where we monitor it on the objective level as well as the activity level. Then we want to be able to have the public view how we're doing in that process as well. So we have a public interface. So then the third step would be going back into that PDCA cycle. So we create the plan, we execute the plan, we go ahead and monitor it, make our adjustments, and go back into the plan. Now, we like to show you a pyramid because the system is very hierarchical in nature, and the pyramid kind of shows that nature. And when you see the dashboard, Fred's going to go in live to a little operational plan. And when you go into the system live, you'll see some navigational tabs from left to right, and that's the hierarchy. So that first tab you'll see is your organization, your health department. Then underneath each level is going to be your groups. So now this is where we can also, a lot of our departments have multiple divisions. So it might be your divisions, and within those divisions, you might have workforce development, QI, your strategic plan. So we can have groups and subgroups. And underneath each group or subgroup, they're going to have their own set of services and initiatives. Those initiatives are like what you're planning on doing in the future. And then underneath each service and initiative, you're going to have your goals, your objectives, and your activities. And then this is where Fred comes in and starts going really fast. And the beauty of working from home, my dog barking in the background, and you get to hear that. So Fred, okay. Are you ready?
I'm ready. Thank you, Andrea.
Okay, I'll be back.
what we're going to do now is we're going to walk through those three phases Andrea talked about. We're going to develop a quick little operational plan. We use the example of tobacco cessation. It's pretty easy to go through and pretty quick. And then we're going to walk it through its life cycle so we can see the various tools to monitor it and also collect the data to keep the information up to date. And then we're going to take it through that PDCA cycle to see how we would go through and make QI adjustments in a plan here. So we have a little demo organization we call USA Public Health, and I will take you live into the system now. Okay, when you log into the system, you'll see a screen similar to this. The number of items you see on the main menu here depends on your login permissions. But up top are these tabs Andrew was talking about. So if you took that pyramid, flipped it on its left side, here's where you see it. Organization, groups, service initiatives, goals, objectives, and activities. So as I go to the right down the tabs, I'm kind of drilling down into the pyramid here. So I'm going to start with my groups tab here. You'll notice it's sitting on Community Health Division. So that was my default group when I logged in. Everybody who logs in has got their default group. The health director typically would be at the top level at the department. And let's assume I'm the community health director for now. So when I logged in, I'm in community health. Under community health, you see we have these groups, Tobacco 2022 and WIC. So I'm going to go to Tobacco 2022 as our group for today. And I'm going to look at the services and initiatives specifically for that group. And you see the three of them here: tobacco cessation, secondhand smoke, and tobacco initiation prevention. Today, we're going to drill down on tobacco cessation. So I'm going to look at the goals again specifically for tobacco cessation. And the goals are kind of a high level goal as to what we're trying to accomplish, not real specific at this point. So for instance, reduce smoking in high schools, or reduce smoking in colleges or public areas. Now we get to this level, we also assign a traffic light out here. The traffic light is just a visual indication of how we're doing in this particular area of the plan. And actually there are 4 traffic lights. Green means just things are moving along as you'd expect. Yellow is things are potentially getting off track. Red is, whoops, things have really gotten off track. We need to address that. Then the gold bar indicates successful completion of this portion of the plan. So now under this particular goal of reduce smoking in high schools, we're going to have a set of what we call SMART objectives. So SMART being specific, measurable, attainable, realistic, and time-based. And that's our definition. We know there's several other variations of that. But that's the one we use. So as an example, we have reduce smoking at Wayne High School by 25% by the end of the school year. So that's a very finite target that we've set. In order to get to that target, we have this person called an objective lead that we've assigned. Steve Hansen is the guy who's responsible to get us to that target. So he's a program manager, project manager, something along that line. Now, a lot of plans tend to stop at this level, especially strategic plans. We've defined the target. We know what we're trying to accomplish right up until somebody comes up and says, hey, that's cool. How are you going to do it? That's what the activities or action steps, some people call them, are. And what the activities are is the set of steps that we're going to go through that we believe will allow us to accomplish that objective here. Now, in the system, there are 3 types of activities. We're going to go through each of these and define the differences between them here. So I have an example of each of them. So our first activity, we're going to create training content and materials for students and faculty on the dangers of smoking. So we're going to create PowerPoints and videos and whatever we need to do, presentations. We have a performance metric which just says, how do I know when I've successfully completed the activity? So if we're creating training content, once we've created the training content, we're done with the activity. We've got a specific time frame we're going to do that in. We've got a measurement over here that just says we're going to be measuring this by % complete. So you notice down in the notes, as apparently Steve was building the content, he said completed chapter 1. This is probably setting at 25%, chapter 2, 50, chapter 3, and chapter 4. Now there are a couple of other options if we use the little wizard guy here. A couple other options. So some activities are just done or not done, or almost answering a question, yes or no. So you have those 2 options here. So I can say yes or no. You notice it converts to a checkbox over here. Unchecked is 0, checked is 100%. So it's just an on-off thing. Or complete. So it just gives you a couple of different options to get to that 0 to 100%. Now, the other thing we have at the activity level is the ability to assign teams of people here. So I click on here and open it up to the whole department. And you can see we've assigned Steve Hansen as our team member, along with Andrea. The team lead is Steve, so he's the head guy for this particular activity. And then the email notification. We're going to talk a lot about the email notification. That's part of what we call the real-time planning. Think about this. You've got a beautiful strategic plan sitting out there. The whole department got involved in it. You built this plan. You understand exactly what you try to do. Everybody buys into it, says it's a great plan, and then you put it on a shelf. And you don't have a vehicle to keep the plan up to date. Without that vehicle to keep the plan up to date, the plan is obsolete very quickly, especially when something like a COVID comes along and you have no plan to be able to handle that because you can't keep it up to date. So that's what the real-time planning is about. It automatically sends out an email notification, in this case to Steve, typically on a monthly basis, to go back in and update this particular activity. In this case, he's going to say how far along is he in creating the training content. And we'll talk more about that. FTE over here is the ability to track the full-time equivalent or the amount of time a person is putting into this activity during the activity time frame. So you can see Steve is a 0.1, Andrea is a 0.3, or 10%, 30% of their time. And what we do with that, one thing is we roll it up the pyramid. So down here, we have Andrea and Steve at a 0.1 and 0.3, equating to a 0.4 FTE at the activity level. If I take these three activities and roll them up to their objective, you'll see down here we have a 1.0 FTE. So what we're saying is it takes about one full-time person to accomplish the task of getting the smoking rate down at Wayne High School. Now back to our activities. The other thing we have, other than internal team members, is external partners. Again, I click on this and you can see we've selected VMSG Dashboard as our external partner organization. And within that organization, we have just one contact. We can have as many as you want. And Fred Erickson is the contact in there. Now, the other thing you can do, this comes in really handy once you get into things like your chip, is the ability to have external partners be that email recipient. So the external partner can get the email, go back in and do the updates on the particular areas of the plan that they're responsible for. Particularly you'll see in the chip, you have a lot of external partners. What that does is save a lot of time and effort in collecting the information, going back and putting it into the system here. So that's our first activity, is create training content. Our second activity then is going to be able to take that training content and provide 9 training sessions each month on the dangers of smoking to students and faculty. So we're going to go out to the schools and we're actually going to do the training. Now this activity is called a QA, or quality assurance activity. Quality assurance activity is unique in a couple of things. I'm going to open the little activity wizard here. Instead of a beginning date and ending date, it's got a beginning date and a frequency. So what it does is automatically keep up with the cycles. So in this case, we got it set to a monthly frequency. It can be anywhere between weekly and every 5 years. But what we're saying is every month, we're going to update the start date on this particular activity. The other thing this one does, because we have a set of values in here we can put in, we can actually go in and say, I'm going to set a value to turn the light to green. So when we get to 9 or more training sessions a month, the light is green. When I get to 6 or less, it's going to turn the light red, and 7 or 8 will turn the light to yellow. So just by looking at the light, we can have an idea of where we are in our performance as we're moving forward here. Again, the activity has got the ability to assign the team members and the external partners in here. So that's activity number 2, our QA activity. Activity number 3, we're going to contact all 20 tobacco vendors within 1 mile of Wayne High School to ensure they're not selling to minors. So in this case, what we have is what we call a quantitative measurement activity. QM activity is very similar to the project-based activity we saw first, but instead of measuring a % complete, we're actually going to calculate that % complete just by collecting values of quantities in here. So in this case, we're saying how many tobacco vendors did we contact in here. I can go ahead and put that value in here, and it's going to calculate against the target of 20, and we're going to have at 100% at this point. So what we're seeing here are the 3 activities that we believe will get us to that particular objective. So now if I go back to the pyramid, this plan that we just developed looks like this. Under Tobacco 2022, of the 3 initiatives, we selected tobacco cessation. The goal we selected was to reduce smoking in high schools. The SMART objective was reduce smoking at Wayne High School by 25%. And then the steps we're going to go through to get there. So that's the planning process. The planning process is finite in the system. Every plan you have, the Fab 6-pack of plans you see up around the top in the bubbles will all be in the same format. And the benefit of that is, as you're looking across plans, it's very easy to understand the plan structure so that you can go back and monitor your plans at any level in there. So that's the planning process. Now, we've got a plan in place. Let's go ahead and take that plan through our PDCA cycle. So we've got the plan now. Next thing we're going to do, obviously, is execute the plan. So in this particular case, we're going to go create the training content. We're going to take that training content and go to the schools and do the training 9 sessions per month. And then in parallel, we're going to go out and start talking to those tobacco vendors just to make sure that they're doing everything right. And this again is where that real-time planning comes in. So if I were doing that on a month over month basis, and I didn't have a method to collect the information, so is the training content complete? How many trainings did we do last month? How many tobacco vendors did we contact? How would you ever get to the check phase without having to go back and collect that information? So that's what the real-time planning does for you, is allow you to collect that information in real time. In the check phase, we're going to be able to go in and take a look and say, hey, how are we doing? Based on having that information collected. So now we're typically going to go back to the objective level here. So the objective says reduce smoking by 25%. Down here at the bottom, it says our current percent reduction is 25%. So we know we've got a plan of 25, got actual 25, everything's beautiful. We can look at the history of that. So we can see that we started out at 0% reduction, obviously with a new plan, got ourselves up there and got to 25 and capped off at 25%. So what we know at this point in time is we have a plan that works. Back to our PDCA cycle. So that was the check phase. If you're collecting that information in the background, the check phase is really that easy. The adjust phase. In the adjust phase, if we need to, we're going to make any corrections in here. So thinking about what we just said, we got a plan of 25, actual 25, plan's working beautifully, don't need to change a thing. So we're going to bypass the plan phase, continue the execution. Every once in a while, go in and check it just to make sure it's still working. It might be a monthly thing or a quarterly thing, whatever you decide. Going to continue through the cycle. Now let's go back and look at a different example. We're going to reduce smoking at Desert Vista High School by 25% by the end of the school year. So in this case, you'll see we have a yellow light out here, and our percent reduction is only at 21% currently. So again, we'll go look at our chart. Ramped up, got up to 21% and capped off. So at this point in time, what we know is we're not making our target. What we don't know is why. So that's where we're going to get down to the activity level and kind of figure out what's causing us to not hit our target. So the traffic lights over here, the first one, the gold bar says, we've got our training content created here. We don't have to worry about that one. The second one with the red light, it says provide 9 training sessions each month. I'm going to go up here and look at our chart. So the first month, the second month, the third month, we did 9 training sessions, and then boom, fell off the face of the planet. Let's assume this is the point in time when kids started staying home due to COVID, weren't able to go to school. Our training was to go to the schools and do that. So at this point in time, we can't get to them. So that's probably one of the things that's causing our issues. We're not able to train them on the hazards. The next one down here is a yellow light. Contact all 20 tobacco vendors. Down here in the notes, it says difficulty contacting vendors due to COVID restrictions. Okay, probably can't get to them. Again, let's go look at our chart. So we ramped up, got up to 15 of the 20 vendors, and there's still 5 vendors out there that, could potentially doing bad things out there. So between not being able to do the training sessions and not being able to contact the tobacco vendors, we kind of believe that's why we're not getting to our target. Now back to our PDCA cycle. In this case, the adjustments could come in a couple different things. And the adjustments are going to be based on not only the information you see in there, but the surrounding information. So think about the beginning of COVID and you just realized that, boy, this is going to eat up all of our resources. We're probably not going to be able to dedicate additional resources to a program like this. So maybe what we want to do is adjust that plan down to have success during this time frame. So maybe we'll take the plan from 25 down to 21 and just say, we're going to try to keep it 21 with the existing resources. The other thing we could do, if possible, is to adjust the resources. So we had a couple of things. We had a training session that was only valid for going face-to-face training. Well, we know everybody's staying at home and learning from home now. Why don't we build a Zoom-based training, let's say, so we can get to those folks while they're at home and do the training there. So maybe we can catch up on our training. The other resource we had was the ability to contact the tobacco vendors. Well, potentially we could hire an external contractor with some grant funds or something to be able to go out and contact those other 5 vendors just to make sure that everything's okay with them. Then the fourth scenario might be that we adjust the plan down a little bit and maybe we just do one of the 2 resource adjustments. Maybe we just take the plan to Zoom or the training to Zoom versus face-to-face training, something like that. So maybe we'll take the plan down to 23 and we can kind of get there and maintain that during the COVID cycle here. So that's the PDCA cycle. Every plan's going through this cycle. It's fed by that real-time planning to be able to get into that check phase and easily go in and determine where you are in the plan cycle here. Now, Andrea talked about macro level performance monitoring. That's what the dashboard tool is all about here. So if I go back to our groups tab here, and I look down here, the groups is the organization of the department plus the high level plans. So you can see what FAB calls their 6-pack of plans up here, down here, and then you see the different divisions, offices, and programs. Let's assume for a second when I logged in, remember I was the community health director. So I'm going to log in here, and I come in the morning, and I have under community health, tobacco and WIC. So maybe I'm going to go up here and say, I want to know how we're performing today. So I'm going to click on the little traffic light up here in the corner. What it's going to do is go up and gather all the data for community health plus the subgroups under community health. And it's going to show me kind of a succinct picture of the performance of that particular operation here. So here's what we're looking at in the top left corner. I call this the big picture. That's the number of traffic lights in each status. You notice that they're all clickable here, so I can drill down and get this particular red activity. I can figure out exactly what that is and maybe figure out how to make some adjustments to get it back on track here. I also have this schedule gauge here, and the schedule gauge is showing me aggregately how far ahead of or behind schedule are we. So it's showing we're 10 days ahead of schedule. It's green when we're ahead of schedule. It's yellow when we're up to 60 days behind schedule, and it turns red when we're 60 days behind schedule. So it gives you a good visual snapshot of the performance of community health. I could look at the activity level, the objective level, or the goal level up here. Down at the bottom, I can drill down to a couple of different things. Number one is my people. So I have the folks who work in community health down here. The first column is last updated. When did they last do their update? Now, again, I keep mentioning it's critical to have that real-time feedback to be able to use the system or to be able to use the PDCA cycle, whether you're using the system or not, to be able to collect that information. So by looking at these, it says everybody has updated their information within the last 30 days. Now, these are color-coded, so over 30 is yellow, over 60 is red. Now, there's an old adage that says people listen to what you say, people do what you audit. So I want to make sure that my people understand that I'm looking at this every day and on the screen and just making sure that everybody's keeping the information up to date so that when I go to make adjustments to the plan, that I know that I'm working with real-time information here. The next column here, FTE, is just a roll-up of the full-time equivalent value by person. So if I assign one person a bunch of FTE across different activities, it'll roll up here just to see how loaded each person is. You can see that Diane is way overloaded at 1.85 and William is pretty underloaded at a 0.7. So I could click on Diane's FTE number here and show me all of her activities. I could potentially reassign some of those to William to get him up a bit, get her down a bit or something. Lagging just means we have activities that are calculated to be behind schedule. The color coding indicates how far. The days column is the same as the schedule gauge for the individual person. Overdue is just that. The ending date's come and gone, and we're not yet 100% complete. And then the number of red, yellow, green, and gold. So that's my first view, is my people. My second view then would be my groups, and that is that same group screen we saw shown down this column, same basic information over here, how the group's performing. And the third one is priorities. That would be the strategic priorities from your strategic plan. What that allows you to do is make sure that everything you're doing in the department is encompassed within your strategic plan. It'll show you the strategic priorities down here and basically the performance of the strategic priorities over here. Top right corner, my priorities. These are kind of objective bookmarks. So the objective, again, is the target here. So I can look at this and say, okay, we have a specific target up here and how we're doing against that target. Again, I can drill down on that, get right down to the objective and make any changes or adjustments I need. Typically, we see the reds and yellows up here because, pardon me, if they're green and gold, they're either on track or completed up here. So that's the dashboard. It can be looked at, pardon me, I can look at the entire department on one screen. I can look at any plan, like my strategic plan on one screen. I can look at a grant on one screen, anything you want. It just gives you a nice, succinct, dynamic view here. Now, over COVID, while you guys were out saving the world, we were adding some features to the dashboard. One of those is what we call VMSG Mobile. And that's the ability to take the most commonly used screens and use them on your phone. So here's exactly the same screen you saw before, broken into 3 phone screens. Top left corner, the bottom, top right corner. Everything is identical. You can drill down on anything on here by touching it. You can get to any of the different group levels, the groups or priorities over here. Everything is exactly the same, but again, you can do this on your phone. Just as an FYI, this is not an app. So you don't have to download anything from the App Store. It's actually an application that's built dynamically from our server right into your phone web browser here. So it's always up to date. So what we just talked about is what we consider to be the VMSG core functionality. We have about 240 health departments using the system across the nation. Most of those folks are doing FAB accreditation. Every one of them who has used the system and put in the FAB 6-packet plans, enabled the real-time planning to get people to do the updates, has gotten fully demonstrated by FAB for 9.1. So it is really, really effective in the FAB accreditation process, but there's a whole lot more to it than just FAB. There's a lot of different things you can do. We're adding new functionality on a daily basis. We're actually adding a new function right now that several people have asked for. We didn't even kind of know it was an issue, but apparently in health departments, they have a lot of standard operating procedures or policies. In this one health department, they have hundreds of them, and they have a problem in tracking them. So how long, has it been since they've been updated? If they have to be updated every year, how do you track that? Where are all the policies in there? That sort of stuff. So we're actually building it into a plan. So you have a plan that has all of, in this case, SOPs attached at the objective level. There's a new kind of activity we're building called a timeline activity that just says, it monitors that document over a timeline. When it gets to, let's say, 80% of the timeline, the light turns yellow. It notifies the person who's attached to that particular document to do the update, that sort of thing, and tracks all that. So just different things that we've found that health departments want. But before I go any farther, are there any questions on what we've talked about so far?
Hi, Fred. Yeah, I've got several questions. Let me just kind of get my questions going. So one of my first questions is, can you assign the red, yellow, green per activity or objective, like those limits? Are you able to customize those limits?
Oh, you can assign for most of the activities, objectives, and goals, the traffic light is a manual process. So it's a determination that you make. Is this on track truly? Or is there something in there that's getting behind schedule? But yes, you can change that. The QA activity that we saw is the only one that automatically sets the traffic light to green, yellow, red based on the values. And you can set those values anywhere you want.
Okay. My next question is, is there different user permissions where, like, can users only see their things, or do they have permission to see everything automatically?
You determine that. As the administrator, you have complete capability of controlling what a user can see and what a user can do. So for instance, you have a set of groups on the screen. You may have an external partner who you only want to see the chip and only want to be able to update specific activities in the chip. You can set all those permissions. It's very simple to do. It's all a point and click. So yes, you can set the permissions down to the, I can see it, but I can't edit it, or I can see it and I can edit it, and I can limit the view to a specific group.
Okay, cool. My next question is on the dashboard, when there are the different columns for the kind of the summary view, are you able to customize what's on those columns, or is it pretty much set?
That's pretty much set for now, but if you have some ideas that you'd like to see on there, we're happy to share that with you. And we make a lot of changes based on, like I mentioned, feedback from the department. So if you got something that would serve you better up there and it would serve everybody better, we're happy to work with you on that.
Okay. You also talked about email notifications. Are those set automatically? Can you set like a specific cadence, or
yeah?
How do those work?
We're going to go kind of deeply into that in a few minutes here, if you don't mind waiting for that.
Oh, sure, I can wait for that.
You're a great person.
So when you have there's activities and there's a start and end date, is there a Gantt view, a Gantt chart view for them as well?
No, what we decided to do, we have the views that contribute to the performance monitoring of the system, but to get into things like Gantt charts, there's a button that you can hit to export any portion of any plan or any plan into an Excel spreadsheet, and then you can do anything you want with it.
Okay.
Because there are so many different options of, different things that people wanted to see. And instead of building all that into the system, we decided let's give them the opportunity to do whatever they want with the data. So they can do one button to export the plan into a spreadsheet and then knock yourself out with Excel.
Totally. Okay. And then you also talked about partners being able to get emails from about the activities or the objectives. I just wanted to clarify, do they have their own login then
Yes.
to go into the system and make updates?
Yeah, the partner has to be a user in the system. So number one.
Okay.
And then you have the same control of the partner. We have a user type called a partner user, and that partner user can't update anything except 3 fields in an activity, for instance. So they can update the traffic light, the data value, and the notes field, but they can't change the activity type, or any of that kind of stuff. So it just limits them to doing updates. And by the way, we will train your partners. If you get partners who agree to do that, we'll train them on how to use the quick update system to do that.
Awesome. A kind of a follow-up question on that. Is there a view-only type of user?
Yes, and that is, there is a read-only user, but there's also the ability to set read-only by group. So I can say this person can just view this group, but they can't edit anything in there. Or I can make the user a read-only user, and the only thing they can do is view and generate reports.
Perfect. All right, that's all my questions right now.
Okay.
Team, do you got any questions?
I had a quick question on the stoplight feature. Is that, are you able to change the range for different plans on what you want to populate as at risk or not?
I don't think I understand your question. Can you?
So I'm just wondering, like, are you able to change? So when I say range, I mean, for example, maybe red is less than 20% of the activities are complete, or, and then for maybe a different project or initiative, maybe that's less than 40%, or since they'll all have different amounts of activities for each project.
Yeah, the traffic lights at the goal and objective level are manual. You determine what you want them to be, and you just basically share that with the people who are looking at it and say, okay, we're going to say, if the activities are less than 20% complete, we're going to mark this as red. If they're less than 40%, we're going to mark it as yellow. And above that, we're going to mark it as green or something like that. You determine what that is. The only activity that automatically sets the traffic light is that quality assurance activity, because you have a set of values that you can say, if it's 9 or more training sessions a month, it's green. If it's between 6 and 9, it's yellow. If it's below 6, and you set those values.
Okay, thanks for clarifying. And then to kind of follow on to that, I was wondering, since we would essentially give them a description to decide how to populate the stoplight, do the activities automatically give you a percentage of complete versus not complete, or are they going to have to go in and count what's been completed or not?
Yeah, it
to get
depends on
that
the
percentage?
type of activity and what you're measuring. Some cases you're just going to put in a % complete because, like for instance, creating the training content. If I'm 25% done, if I've got 4 chapters and I got 1 chapter done, I'm going to mark that as 25% done. So yeah, most of the activities are percentage-based, the project-based activities. But if you're actually counting something, like doing 9 training sessions a month, you're going to be able to go in and say, this month we did 8. And that's going to set the traffic light for you and set a data point in there for the graphs and charts and that sort of thing.
Okay, I was thinking more just from like a project management perspective of knowing overall how much % towards completion they were at, just to give you some context.
Well, yeah, again, let's say we have an objective, and under the objective, we have a set of activities. At the objective level, I'm going to be able to say we are 40% done at that level. And that's the highest level that you can determine a % complete, but that is your finite target. That's what you're trying to accomplish. So yes, and again, that is a manual setting. And the reason it's a manual setting is because the activities could have different weightings. You might have one activity that is a 90% weighting of what we're trying to accomplish and one that's only 10. So if you just average those together, you're going to end up with an invalid value at the objective level. Now there is another option. Let me take you back and show you at the activity level again here. Hang on a second. Walk back down to this. Okay, this checkbox over here is a roll-up. So if you're using activities, a QM, quantitative measurement, or a quality assurance activity that is actually measuring quantities, you can roll up the quantity to the objective level. So let me give you an example where that comes into play. I have I'm doing restaurant inspections, and I have 5 restaurant inspectors. I want to do 100 restaurant inspections per month, and I have 5 inspectors, so they're each going to do 20 per month. So the activity is Fred will do 20 restaurant inspections per month. Andrea will do 20 restaurant inspections per month, and so on. What I can do is roll that up to the objective level and say, aggregately, we are at 100. Average, we are at 20, or less or more. So it allows me to do an automatic roll up of that if we're counting something. The reason we only do that if we're doing values like that is because you can't average percentages, again, because of the weighting. And you can't say that one activity is at 100% and one activity is at 10%, and together, it's a 55% average, because you don't know the weighting on the activity. So that's the reason behind that. Does that help?
Yes, thank you.
Okay. Okay, let's go ahead and go into the next toys here. Document management. Originally created for accreditation. As you guys know, you've been through the accreditation process. You know it's very document intensive. Health departments have told me that they've submitted anywhere between 300 and over 1,000 documents into the EFAB system for accreditation. All this is a vehicle to manage the documents. You attach the documents typically to the accreditation plans that are built into the system, walks you through the whole process. When you're done, you're ready to go. There's a virtual mock site visit in here. We'll show you. But you have all the documents in one place. You take them out of our system, move them up into the EFAB system, and away you go. There's no limits on the number of documents or the size of documents that you can have in there. And again, you can use it for anything you want. A lot of people use it for grant management. So you got a little plan in here to manage your infrastructure grant, and you know that you got to provide receipts or whatever back to the grantor on a certain quarterly basis or whatever. You can build that plan in there to manage that whole process, and the documents are attached right there that you need. So unlimited document management, if you will. Three-dimensional planning is the ability to look across all the plans for commonalities, for gaps, for overlaps. So for instance, you want to know, how are we doing on Public Health Essential number 1 across the whole department? You can do that. FAB standards are in there. So, everything in the department that rolls up to FAB standard 6.1. And by the way, I can then do a report on that, or I can go in and just show everything that is FAB standard 6.1. So think about your site visit with FAB. You can go in there and they'll say, how are you doing on 6.1? You can show them everything across the entire department related to 6.1 in one screen. The strategic priorities from your strategic plan are all mapped into here. So you can go in and say, these are the things of the other plans that are mapping back to our strategic priority of partnering. And then you can categorize all the documents as well. So I can go in and say, these are the 3 documents we're going to submit for FAB standard 4.2. So it's just a way to look across everything in the system for commonalities, gaps, overlaps, and such. This is the question you're asking about the intelligent real-time planning. What it is a regular cycle of emails that go out. You determine the cycle. It can be anywhere between daily and monthly. So what you're going to do is, typically most people, by the way, set it monthly. So here's what happens. Let's say we have it set for the first Monday of every month. On that first Monday of the month at 1 o'clock in the morning, the system goes in and it looks at everybody that you've assigned as an objective lead and an activity lead. And it asks 3 questions. Number 1, have you been in the last 30 days and updated your stuff? Number 2, do you have anything that's behind schedule? Number 3, do you have anything that's overdue? If any of those is true, out go the emails. And again, the emails can go out to those external partners as well as internal partners. And again, we'll train them on how to do it at no cost to you. So the emails go out. In that email is a link, takes you back into what we call the quick update system. A quick update system is a very simplified pair of screens, objective screen, activity screen. And that pair of screen allows you to only enter 3 values. You can change the traffic light, put in the data value. So I did 9 training sessions this month. I can put a note in there that says, looks like students aren't going to be staying in school very long. We might want to adapt to that or something like that as a note. And then you hit the next button, cycle through all your activities. You'll cycle through your objectives. You'll log out and go home. And just as a point of reference, across the 240 some odd health departments using the system, this process averages about 3 to 5 minutes per person per month. So it's a very efficient way to collect information that you can use in the check phase of your PDCA cycle. Just an example, this is what the activities quick update screen looks like. The top of it is nothing but the top of the pyramid, just a reference point here. It says I'm activity 1 of 6. So I've got 6 activities I'm updating. Change the traffic light just by cycling through it with your mouse. Put in a data value in here, put in a note, hit the next button, cycle through my activities. If I've been assigned as an objective lead, it'll take me to the objective screen, 3 fields again, update them, go through, log out, and you're done. So that's a very efficient process to collect that information. Again, 3 to 5 minutes per person per month is not too much to ask to keep all the information up to date for everybody to utilize. You can also do the quick updates on your phone. So the example I use is you're driving in the morning, you stop at Starbucks to have a coffee, you look at your phone, it's that first Monday of the month, there's the email from VMSG, you click on the link on your phone, takes you into here, you do your updates, you log out, and you're done for the month. All kinds of reports in the system, any level of detail that you want. The typical report that's used about 90% of the time is this operational plan report. For the example we've been using with tobacco cessation, it would look something like this. So the group was Tobacco 2022. The initiative was tobacco cessation. Any documents that are attached show up in green, and they can be attached anywhere. You can attach it to a group all the way down to an activity. You can attach it to a person, anything you want to, just as a reference point. The goal, there is at the goal, objective, and activity level, there's a data source field. There's a description, and then there's a link. And the link in this case might be to the CDC Smoking Cessation Fast Facts webpage, which we actually have in there. And what it is just the ability to have pop open a web page of the reference points that you want to use to keep track of that particular goal in this particular case. So lots of value in having that data source immediately at your fingertips without having to go look it up. So it just helps you to do your updates. Now, this is the highest level of performance monitoring as far as detail goes. Not everybody wants to see that detail. A lot of people just want to know how we doing. That's where VMSG Public came from. So this is an example of a VMSG Public page for the tobacco cessation. We can do this at any level, from the group level all the way down to an activity. So I'm looking at the goal here. I do my rollover. It says I have 3 gold activities. I have 1 green, 1 yellow, 1 red, and I'm 11 days behind my time schedule. These are called indicator rows. You can have as many on a page as you want at any level that you want to have them in there. Bottom line is you create this unique web address. That web address is hosted on our server. You can grab this, put it into an email, send it out to senior management, to partners, whoever. You can give it to your IT folks and say, hey, please put this link up on our website so the public can see it. You know, it's one of the FAB requirements of being able to share that information with the public. Perfect way to do it right here. I see this used a lot in quarterly strategic plan updates. So the top is the entire strategic plan typically. Underneath that is each of the strategic initiatives, and you can go all the way down to the goal, objective, and activity level if you want. But typically the whole plan and then each of the initiatives is on a screen like this. And you share that with the public or share it with whoever. One more section to go through. Any questions before I go there?
I had a quick. Oh, go ahead, Crystal.
Taylor, you go.
Okay, I had a question on with the activities and the quick updates. Does it record like the previous update? Like, I just want to make sure whenever you update, it doesn't necessarily like write over what the last update was.
Let me show you how that's done here. So I'm down at the activity level here. This little hourglass is my history record. So I click on that. It's going to show me this is every update that you've ever done on that particular activity. And obviously in a demo system. We have a lot of updates in here. But yeah, everything is tracked in here that you've done over whatever period of time. You can also use this feature to go in and put in historical records. So I can I can create a history record, click on it, go in and change the date, maybe back a year ago or whatever that happened to be, so that, because you're not going to be starting your life with the VMSG dashboard. You're going to have things before that you might want to put in. So you can put in history records going back as far as you want. So now you can go back and look and say, from this date forward, we're in VMSG, but previously we had this information in there. So yes, everything is recorded in a history record.
Okay, and then just another question about that. With whenever you pulled up that quick update feature, does it show what the most recent update was? I'm just thinking,
Yes.
like, for example, if someone needs to go in and update and they kind of are forgetting where they were at last point.
Yeah, I can
Or
go
they
in a
have
quick
something to
update
work off of.
from right here. So let me show you the screen. And yes, it does have the most recent information in there. So yeah, here's the one. In this case, it has, I don't know what this is, $72 or something, but yeah. So this is the current status in here is 91. The nice thing about this is having the notes in there. So when I do an update and I do anything unique, I'm going to put a note in there so that maybe the next person who goes in and does it, or the next time I go in and do it, I have a terrible memory. I might go in a month from now and say, oh, I remember I did that. And I'll go back in and put in another note and put in the data value and cycle through the traffic light.
Awesome, thank you. Yep, that was exactly what I was looking for. Thanks.
Oh, good.
Christella, did you still have a question?
I think I did. Let me try to remember it. Oh yes. So when you say that you can do the public page for those little indicator rows, is there a limit on how many individual websites we can have?
Nope, you can have as many as you want.
Okay.
There's on the main menu here, you'll see manage the performance indicator rows. That's those individual rows. And then you can manage the web pages. So you see I have a dozen or so web pages on here. Each one of these web pages is consisting of a bunch of the indicator rows, which are these. So you can have any rows, and then I can build a new one easily just by checking. So this is click, 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 pick 2 or 3 of these, boom, hit the export into a page, and I've got a new page with a new URL in there.
Gotcha. Thank you.
Cool. Okay. Last section, we're going to talk about the accreditation process here. So let me go back into my group screen here. And so built into the system are every accreditation, FAB accreditation plan known to man. So if I take you back here to the group screen, go down here, we actually have state plans for Illinois, Michigan, and North Carolina in there because we do the entire state accreditation process for North Carolina. We're working with the other ones now. But all the FAB plans down here that you see, so you have FAB accreditation version 1.5, which is probably what you guys got accredited under recently. And then now we have the FAB 2022 plans. Now, the one thing, and being the guy who built all these plans in here, I was really, really impressed with what FAB did going from 1.5 to 2.0 or 2022. And the fact that they took it from 12 domains down to 10 domains, which was huge because they really only needed the 10. The other thing they did is took it down from about 135 measures down to 85 measures, which is awesome because it streamlines things so much. Then so if I drill down here, obviously you're going to get down to the standards. Underneath that are the measures. So this is, develop a community health assessment is the measure. The notes here says the document that you require is one community health assessment dated within 5 years. So if you're like me, you're going to say, well, that's cool, but what all is in a community health assessment? That's where the activities come in. So these are the 7 things that are required in the community health assessment. You see this first one says, include in the CHA a list of participating partners involved in the CHA process. This is document management right here. I click on that. You'll notice I have the partner list as a document in there. I can have as many documents as I want. I can have as many versions of this document. So every time I update it, I can create a new version. I can show just the latest one or show all versions. So it automatically does version management for me in there. So all that is built into the plan. So what we typically do on a plan like this, when you guys get ready to go into reaccreditation, we have the 2022 reaccreditation local, which would be, I think, no, you guys would fit into the state. There's a state version of this too. I apologize. I just don't have it showing on here. But the state version of the plan, what we typically do is say, okay, you tell us who your 10 domain leads are. We'll push that all the way down to the objective and activity level. You tell us when you're planning on submitting your documents. We'll push the end date for all the activities down there. And then you'll tell us when you want the start date to be. It can be anywhere between now and whenever you want it to be. And when you get all that information in there, then it automatically starts generating those email notifications to the people who are designated as the objective and activity leads. So they'll get a monthly email that says, hey, you might want to look at doing this if they're behind schedule on doing it, or if they're overdue on doing something in there. They can, hey, your strategic plan needs to be done by such and such a date, whatever that happens to be. But it's just a methodical process to walk through the reaccreditation process here. Like I said, all those plans are in there. You can have as many of them as you want. We don't charge for any of the plans, but you're welcome to accreditation, reaccreditation. The pathways recognition program probably wouldn't apply to you guys since you're already accredited, but that's the newer 35 measure kind of mini plan. Something else that came up over COVID was the ability to do a virtual mock site visit. So what a lot of folks do before they go into their FAB site visit is they'll hire somebody to come in and go through all their documents and all their plans just to make sure they got everything lined up ready for their site visit, so they will pass the site visit. Well, the fact is that nobody was traveling over the last couple of years, so what we did is built a virtual version of that. And so what they can actually do is if you assign somebody as your site visitor, mock site visitor, they'll have this review button pop up on every activity screen. It'll open this pane that shows the notes that they put in there. They can set the traffic light. A lot of different things that they can put in there. Anyhow, basically what they're doing is going to review everything that you have. When they're done, there's a report called the Accreditation Review Report. It shows all of your activities plus every one of the notes that are put in here on the review pane. And then you can go back and review it, look at the traffic lights and say, hey, we're all green or we're all gold, we're ready to go. Or, hey, our strategic plan is marked red. You look at it, it says, hey, your strategic plan is going to be expired by time the date to submit your documents comes around or something along that line. So it's a tool that's in there. It's not necessary to use, obviously, but it's a nice tool to have to get somebody to do that. Again, we'll train whoever you decide you're going to hire to do that to go through this process. Quick start. Now you guys have already got, you were with us a couple of years ago, so you guys have already got a plan or an organization in the system here. In fact, let's just real quickly take a look at that. So this is the group screen from your current organization in the system. So at the top, you got the department, you got your FAB 6 pack of plans, you've got the reaccreditation 1.5. We'll change that out for you. Pandemic planning, and this can all be changed around. You got the regions under here, so you can actually build subgroups under regions if you wanted to have each region having their own set of plans under there. You can do that as well. But this is the current stuff. I think the only thing that I really saw in here was your strategic plan, which looks something like this. You got part of it down to the activity level, and part of it is just at the objective level here. But this is it, and it's up through June 2022, it looked like. So maybe it's not too badly out of date that could be updated in here. But so, we've got your organization built. You probably have a new org chart by now, so you can send us that. We'll get it put in there. Go through your users. Maybe some of them are still there, some of them aren't. We'll put the new user list in there. The graphics are just basically your logo, which is already in there, and you may have a new one too. We're going to provide introduction overview training to your entire team. The reason this is important is because Andrea has this thing. She says, have you ever tried to build a jigsaw puzzle without the box? Giving them the overview shows them, here's the box, here's what it looks like. So when you get done with everything, it's going to fit into this box here. And then we take one or more of your plans. So if you got a new strategic plan or a chip or whatever, we'll structure it into the system. And typically we take one of the initiatives all the way down to the activity level to show you how it works in the system. And then we'll go back and, like I say, we'll structure it in there. Then we'll go back and provide a training on, here's what we did, here's what the next steps are to finish getting this plan in there. We'll turn you guys loose to finish the plan in the system, and then we'll go back and have a review training. We actually walk through everything that you've done just to see that it all looks like it's fitting perfectly in the system. And then we have a lot of ongoing training around performance monitoring, how to actually develop an operational plan, different things along that. For the administrators, there's training on how to assign permissions and set up different types of users and all that kind of stuff in there. So that's how we get you up and running. Like I say, you guys are ahead of the schedule because you already have an organization in there. If you are the type of person who likes to do e-learning, e-learning is all built into the system. Take you back over here. So I'm at the services level here, and I have a question about something in here. What I can actually do is go to the little blue eye up here, and it took me right down to adding and managing services. First thing I have is just a bulleted list of the things that you can do to add a plan, edit a plan, delete a plan, whatever you want to do. Down here is a video link to a training video. It's typically about 5 minutes long, specifically on services. There is a complete user guide here that is a hyperlink PDF file you can print or dock on your desktop. And then implementation guidelines is just a bunch of stuff that we've collected over the years, feedback from customers, stuff for your IT folks about firewalls and email whitelisting. There's actually a couple of templates in there. One of our Wisconsin departments developed a nice operational planning Word document template to allow his people who are not comfortable going into the system yet to actually develop a plan and a template and then copy and paste it into the system. So lots of good stuff. Up here in the top left corner are 5 training videos. The introduction is kind of similar to what we're doing today, plus kind of a superset of what we're doing today. Just again, introducing everybody to what the system's about. Basics is every button, every screen on the system. Operational plan development is, what's in an operational plan? What does the different levels look like? How do we do it? Performance monitoring is all about the VMSG public and the traffic lights and the graphs and charts and all that kind of stuff. Administrator level training is, how do I manage the user permissions? How do I see who can see what groups, who can edit what groups, that sort of thing. Lots of different things along that line, and also partners. So that's all built in there. If you're the type of person who likes to do that on your own time, it's in there. If you like to do it real time on a venue like this, we're happy to do it that way as well. Quickly, benefit summary. We'll show you the price model here. It's a very cost-effective system. The dashboard, once you get your plans in there, the dashboard's a great tool just to monitor real-time performance. The real-time planning is how you collect all that information in the background. Three-dimensional planning is, to look across everything for gaps and overlaps and such. All the accreditation plans are in there. Again, fully demonstrated by everybody who's ever used it for accreditation. System is completely cloud-based, so the IT folks don't have anything to worry about. Just got a web browser with no plugins or anything. And then VMSG Mobile, same thing, web browser on your phone. That's about it. So that was, as promised, your drink from a fire hose. Questions, please.
Ta-da.
Fred, would you mind to repeat those 3 questions that you said the system asks before it sends out an email?
Yes. First question is, have you been in and updated your stuff in the last 30 days? If not, you're going to get an email. The second one is, do you have something that's behind schedule? So if I have an activity that is January 1 through December 31st, and I have it set at 50% complete, but I'm 60% through that time, so I'm in August or something like that, it calculates that to be behind schedule. If I have an activity that's January 1 to December 31st, and it's now January 1st of the next year, it's behind, or it's overdue because it's past the ending date. So those are the 3 elements that causes it to send out an email.
Great, thank you so much.
No, you're welcome. Anything else? Well, let's show you the pricing model, and we'll see.
Well, they have been, I would say a client, and the pricing hasn't changed, but we can show it to you. Anyway, we designed the pricing so that not only the smaller departments who might only have like, 8 to 10 FTEs can afford it, but also the larger ones when they get up into the large numbers. So and by the way, we have not changed our prices in years. 1 to 50 users on the system is $100 per user per year. And then when you add one more, it goes down to $50 per user per year. So the first 50 is 100, and then from 51 to 125 is $50 per user per year. Then after 125, because we have some departments that have, in the hundreds, and it goes down to $25 per user per year. And I think what you guys had
45.
before in the system was 50 to start out, and then bam, COVID happened.
Yeah, I think there were 45.
Were they?
Yeah, I believe so.
Oh, you mean right there in front of me? Well, did you so much fall in love with it that you want to do performance management like today? Can't wait to get on it.
This is a really great presentation. Thank you so much for going through all the stuff that you did. It's really impressive to see that all the fab plans are kind of preloaded and there's a nice structure to follow.
I think that we have the advantage of, as well as it could be a disadvantage when you have a pandemic, when you're only public health, right? But our advantages are, far outweigh, because if we can bring value, then it's good. So we can customize, those types of reports or put in the plans, or like I said, the big thing now, what we're doing to a lot of our clients' dashboard is adding those standard operating procedures, because I guess they come due multiple times, multiple years, and so that's kind of fun. It keeps Fred awake at night. So is there any other questions we can answer for you, or
I feel like I've gotten a lot of my questions answered. Team, you got anything?
Would you like Andrea to send you like a tiered price quote, just so you have that information?
Yeah, that would be helpful if you don't mind sending that over. I think you all also answered all of my questions too, so thank you so much.
Oh, you're certainly welcome.
all right.
Thank you for your time, everybody.
And yeah, we appreciate it. And I'll go ahead. Do you want me to send this just to all of you, or just to Michelle, just Christella?
You can go ahead and send it to me and I'll forward it to everyone if you don't mind.
That sounds great. All right. Well, thank you so much. And I hope you guys have a great rest of your day.
Thank you. You
Oh,
too.
we really appreciate
Thank
your
you.
time.
Bye-bye.
Thank you. Bye.
Bye.